quali sono i biomarcatori emergenti e più promettenti per la biopsia liquida? Ne parliamo con un'esperta, la dottoressa Atocha Romero dell'Hospital Puerta de Hierro di Madrid, che abbiamo incontrato a Milano durante Next to Oncology, un evento organizzato da Over con il supporto non condizionante di Daiichi-Sankyo, durante il quale si parla a 360 gradi di innovazione in oncologia. Dr. Romero, in your speech about emerging biomarkers in liquid biopsy, you have talked about detection of ALK fusions in extracellular vehicles in patients with non-small cell lung cancer. Could you tell us something more about this topic?
We have a lot of targeted therapy for lung cancer patients, so it is very important to perform biomarker testing for these patients, because otherwise we may impair the survival of these patients. However, there are some alterations that are difficult to detect in the liquid biopsy, and that's the reason why there is an intense research to improve the sensitivity of techniques. So one approach is to detect the translocations, mutations that are translocations that involve a large number of base pairs, such as, for example, ALK translocations, NTRK, ROS, or RET translocations. And because these translocations may guide or can guide targeted therapy, we need to, as I mentioned, improve these methodologies. One approach is to use exosomes or extracellular vesicles to as an starting material with liquid biopsy. And this is why is this? Because a way to identify a translocation is by sequencing the RNA, the cDNA from RNA. Could be potentially easier than sequencing the DNA. But the RNA degrades in the blood due to the RNases in the bloodstream. And so one approach is to use RNA which is protected. And this is the RNA inside the vesicles. And that's why exosomes and extracellular vesicles hold promise for non-invasive biomarker testing.
Another potential biomarker you have cited in your speech is the evaluation of minimal residual disease in lung cancer. Could you tell us something more?
Yes. So in the recent years, there has been made a lot of improvement in treatment of lung cancer patients, and especially in locally advanced lung cancer patients. So the survival of these patients have improved substantially due to the advent of novel treatment strategies based on chemoimmunotherapy, specifically neoadjuvant and perioperative treatments based on chemoimmunotherapy. So in this new scenario in which we have a lot of patients that before were diagnosed with a probably lethal disease and now are diagnosed with a potentially curable disease, we need to novel biomarkers to tailor subsequent treatment after surgery. And one approach is MRD, the measurement of minimal residual disease. And so there is a lot of effort, international efforts to improve these methodologies to help clinicians to tailor treatment after surgery.
In addition to what you have just explained, are there other promising biomarkers?
So there is an intense research in the field of liquid biopsy. We need to increase the sensitivity of the technologies, and so there are many approaches that have been explored, like using fragmentomics, studying the end motifs of the ctDNA, the length, which is fragmentomics of the DNA, circulating tumor DNA fragments. And so I think we need to wait to see if the combination of different strategy yields better sensitivities, and we can perform assays with very, very high sensitivity.
Finally, in your opinion, what are the significance, the value, and the importance of an event like Next to Oncology?
So with these events, researchers can bring their recent research to to the public, and we can share ideas and explore novel research lines. And I think that bring together all these ideas and innovations in the field of, in this case, liquid biopsy. It's very important and very it's a good learning experience.